Hello and welcome to week 10 of NUR1000. Just a quick reminder, if you have any missing work for this course, it must be completed before I'm going to be able to enter your final grade. So what you want to do is look back at your grade book and see if there's anything you didn't get full credit for, and then double check and make sure you submitted all the work for it. For instance, if you didn't complete an initial discussion board post by the due date, but then completed the peer response post by the due date, that grade would be 2 for you in the grade book because you couldn't, once you missed the due date, and this was more after the first month, I was a little lenient that first month, but once you missed that first due date, you lose the ability to get the points, but you still have to do the assignment. So look through if you have any low scores and make sure that you did complete the work, even if you weren't eligible to receive the points. Practice questions, quizzes, anything like that would have to be completed even if you missed the deadline in order to get points for them. I will be reaching out in the next 2 weeks or so if you still have missing work. So you can expect to hear from me in about 2 weeks or so if you have missing work that you haven't yet got up to date. So a quick week 9 review. I just want to remind you that there are the test taking tips for prioritization and delegation NCLEX style questions that can be found on Canvas with the PowerPoints. And I recommend that you review these regularly so they become sort of second nature to you, the type of thinking you need to be doing when you're seeing questions regarding prioritization or delegation. Just a review of that delegation test taking tips handout that's available for you on Canvas. The RN, it's the RN's responsibility to follow up on anything that was delegated. You have this nice chart outlining what the RN can do, what the LPN can do, and what the UAP can do. Do not delegate, you as the RN, what you can eat, evaluate, assess, and teach. And remember that it's not always going to specifically say the word assess. So it might say monitoring or checking. Might use other verbs that you're going to have to be able to interpret. Is that an assessment or not when you're deciding answers for these types of questions? Instead of teaching, they might say showing, demonstrating, educating. You're going to need to be able to evaluate those verbs, those action words, and determine is that an RN, an LPN, or a UAP question. Some other things to consider: if you get a scenario in the question where it has an RN, an LPN, and a UAP, and it's asking you about what the LPN can do, don't just go to the lowest level sort of answer option and say that's what I'd give the LPN, because in your scenario, if you have a UAP, you're also going to be looking to see which of those answer options would be appropriate to the UAP, right? So if you have these 3 people here, here's 4 tasks, what are you going to give to the LPN? And one of them is assist the patient to the bathroom. And you figure, sometimes students will figure, well, I'll just give them that. It seems like the lowest level task. That seems appropriate. Well, that would be more appropriate for a UAP, which you have based on the question stem. So just keep that in mind when looking at them. A big thing that gets students is that the LPNs cannot assess, but they can gather data. So when looking at the answer options, you need to ask, is this an assessment? Because sometimes students get confused. So they can listen to lung sounds, which we learn is part of an assessment, but they can't assess. So how does that make sense? So when you read something, ask yourself, is this part of gathering data? So I can listen to lung sounds once. I can put in, let's say the RN has charted that the lung sounds have been clear, clear, clear all day, multiple days, and I, the LPN, come in and I listen and I hear crackles and I put in crackles. So I, as the LPN, I'm able to gather data, listen to lung sounds, put it in the chart, but then it's the RN's responsibility to assess the data that's been provided, to look at trends and determine, is my patient getting better or worse? And of course, the 5 rights of delegation you'll want to remember. All of your examples about happy things in your life that help you cope with stress were all great. Just sort of a mid-ish term reminder of focusing on things that make you happy and things that can help with dealing with stress of the nursing program and in general with life. When you get out and become an RN, what sort of techniques and tools are you going to use to help yourself deal with stress in your life. Then you also did some practice delegation questions. Let's look at those. All right, question 1, you were delegating to a UAP. Correct answer was remind the patient to sleep on his side instead of his back regarding sleep apnea. So remember, UAP's LPN can remind patients about education already provided by the registered nurse. We know the UAP isn't going to administer meds. We know that they don't teach because only the RN can educate, assess, and teach. And discussing weight loss strategies such as diet and exercise is a bit of teaching as well related to sleep apnea. Question 2, you got a patient with COPD. What are you delegating to the UAP? Correct answer is assisting the patient to sit up on the side of the bed. This is what intervention for airway management can we delegate to a UAP. So assisting the patient to the side of the bed is correct. Instruct, we can't delegate because that's teaching. This one even says the word teaching. We're not delegating that. And auscultating breath sounds every 4 hours. Gathering data would be appropriate for an LPN or an RN. Then the RN could assess it, but not appropriate for a UAP. All right, which intervention for a patient with a pulmonary embolus with the RN assigned to a LPN. So this student wanted to evaluate the patient's reports of chest pain. And again, this is when these LPN questions get confusing because the LPN can gather data. So the LPN would be able to ask the patient to rate their pain. That would be gathering data. But this word evaluating tells us it's an RN job to be doing, right? Evaluating, assessing, teaching is RN. So evaluating is RN. Monitoring is like evaluating, watching for trends, all that good stuff. Assessing, we know, is RN. So auscultating the lungs for crackles is appropriate to delegate to the LPN. They are able to listen to lung sounds and they are able to gather data. Next question, preparing for colonoscopy, delegating to the UAP. Reinforcing NPO by mouth status. So the UAP can reinforce dietary and fluid restrictions. The RN has already explained, but we're not going to be explaining or teaching. The UAP, rather, isn't going to be explaining or teaching. They're not going to be administering meds or an enema. 5, who are you going to delegate? What are you going to delegate to the LPN? Correct answer is assisting the healthcare provider to incise and drain assist. They're not going to teach, not going to be able to evaluate. This one, describe the basic pathophysiology of an anal fistula to the client. That's teaching, so they wouldn't be able to do that. While working a cardiac step-down unit, precepting a new RN grad who's part of an orientation program. What is the best thing to assign to the new grad? So this student thought maybe the patient with rheumatic fever who needs discharge teaching before going home. The correct answer was actually the patient admitted 1 week ago with endocarditis receiving a scheduled dose of ceftriaxone. And the reason why this is correct over the other one is because this patient, so they've been there a while and they're getting a medicine they've been getting. So continuing to get scheduled dosing of an antibiotic. The reason this answer that the student thought might be right is incorrect is because they need discharge teaching. And if I'm a new grad, I might not be the best person to give someone discharge teaching, right? To provide that sort of teaching. Also incorrect was someone newly diagnosed with questions about meds. Patient who just been transferred to the unit after undergoing coronary artery bypass grafting yesterday. So there would be more appropriate for a nurse with experience as well. 7 here. An experienced LPN under the supervision of a team leader RN is assigned to provide care. What actions are appropriate to the scope of practice of an experienced LPN? So we know that they can listen to breath sounds. We know that they can administer meds, so both of those are correct. The RN would be the person completing an in-depth admission assessment. Yes, they can check oxygen saturation using a pulse ox. The RN would be developing the nursing care plan, and the RN would be evaluating the patient's technique for using meter-dosed inhalers. Okay, we're now going to look at our week 10 expectations. And just a reminder, this week there will be quiz number 2, which is worth 25 points. So it's important to get through the module and get all the assignments completed, including this week's quiz number 2, because it does carry more points than you usually see for your activities. It's worth 25 points. So let's look at these week 10 expectations. All right, for your week 10 expectations, you're expected to read chapter 10 of your textbook. You're currently listening to the week 10 greeting or welcome video. You have another lecture regarding communication, culture, and some different NCLEX item types, highlighting and drag and drop. You have a discussion board about communication and culture. And then you have 2 activities, practice questions regarding communication and practice math. And then finally, quiz number 2, which is worth 25 points. So don't forget to get through that quiz and get through the entire module.